This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. In classic Greek mythology, as Boris Johnson knows, an enslaved Hercules was tasked with 12 labours in order to escape the sickly King Eurystheus. They were considered all but impossible to complete, slaying monsters, fighting three-headed dogs without Harry Potter's help, fetching golden apples, that kind of thing. The point is, they were, to use a modern word, Herculean challenges that required individual strength, teamwork, perseverance, patience, and courage. In order to escape the coronavirus lockdown, the UK faces just 5 tests. Does the NHS have enough capacity? Has there been a sustained and consistent fall in daily deaths? Is the rate of infection decreasing? Is there enough PPE to meet demand? Is there a risk of a second peak? These are the government's and the country's Herculean challenges. To lift the lockdown, every one of these has to be overcome. So how close are we? Our Deputy Political Editor, Nicholas Cecil, has been taking a look and joins me now. Nicholas, have we met the 5 targets?
Well, we've met a couple of the tests, that's quite clear, and a couple probably have not been met, and one is probably not very clear at the moment. The first test, which is that the NHS has sufficient capacity to provide critical care and specialist treatment right across the UK, that one looks pretty clearly to have been met. Hospitals are now restarting operations which were cancelled as the COVID crisis started, and less than a third of critical care beds are now occupied by coronavirus patients. Also, if you look at the number of people in hospital with COVID, that has come down really quite sharply. In early April, the figure was heading towards 5,000 in London alone, and now that's down to around 2,000. The second test, which does look to be met, is one for a sustained and consistent fall in daily deaths from coronavirus. The third test, which is reliable data to show that the rate of infection is decreasing to manageable levels across the board. Now, on this, scientists believe that the rate of infection, what is known as R, is around 0.7. And that means that each person is on average passing the infection to less than one person, so the disease is now on the decline. But what the scientists don't know is the level of infection across the country. And what ministers have ordered here is a study, a very wide study, around 20,000 people across the country, which has been carried out by the Office for National Statistics. And this is trying to measure the level of infection in Britain, and that's a crucial missing piece in the jigsaw before they can start relaxing the lockdown.
And where else are we struggling?
Now, on testing, the government has a capacity of around 100,000 tests a day at the moment, and that's enough to start relaxing gradually the lockdown. But it also needs an army of new recruits, of people who can trace the disease across the country. Initially, Matt Hancock, the Health Secretary, has announced that he wants to recruit 18,000 people for this huge exercise. Sir Keir Starmer thinks the figure should be even higher. He believes you probably need around 50,000 people for this huge track, trace and isolate operation. The problems with PPE, they've been very long running and they have not been sorted yet, particularly in care homes. There are shortages with care home workers not having the correct equipment yet to do their work properly. And then there's the final test, which is the government being confident that any adjustments to the current measures will not risk a second peak of infections that overwhelm the NHS. This one is not that clear-cut. The scientists are still discussing very carefully a whole range of measures which could be taken to relax the lockdown. So very intense discussions going on at the moment in Whitehall. But having said that, for a second peak to overwhelm the NHS, that would have to be an even worse epidemic than we've had so far, because the government has set up a network of Nightingale hospitals across the country with thousands of extra beds, which were never used in the first peak. So for a second peak to overwhelm that, it would really have to be pretty horrific.
On that last one, there is a concern, apparently, that people might deliberately get themselves infected, Nicholas.
Yes, this has emerged from documents released by the SAGE committee, which is the scientific body which advises the government. One of the papers that they looked at a few weeks ago, discussed what will happen when antibody tests are available. These are the tests which will tell whether somebody has had coronavirus. Now, the concern is that you could have a two-tier system of people in the country created by these tests. So people who have had COVID would then be able possibly to return to work more easily, possibly even to go out more easily. Whereas people who tested negative, i.e. they don't have the infection or did not have the infection, then they could, in theory, be discriminated against by their employers, saying we want people who have had COVID working rather than those who hadn't. So the suggestion from the paper discussed by the committee is that some people may actually then deliberately go out to try to get infected so that they are classed as having had COVID, or that there could be other ways to game the system, such as fake tests.
I don't think that people deliberately infecting themselves with COVID-19 was probably in the government's original projections, but these are all the things that need to be considered, don't they, when they look at lifting the lockdown on Thursday, and I believe the Prime Minister is still to make a statement on Sunday.
It's really a very, very tough choice facing the Prime Minister. It's certainly nothing he could have imagined he would have to make less than a year into office. And he basically is having to weigh up the pros and cons of lifting the lockdown and how much that would benefit the economy. And it comes down really to deciding the level of tolerance for coronavirus, with more outbreaks likely and almost inevitably more deaths, and weighing that up against the clear benefits of trying to get the economy going again. Because the lockdown is not a solution to COVID. It just buys you time to try and find a vaccine or to develop medicines or to put in place the test, track and isolate system you need. But ultimately, the lockdown has got to be eased very gradually to try and get a degree of normality returning to Britain.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.